If you have an older or fragile cat, you know that thinking about a dental procedure is, well, it's one of the most stressful things you can face as a pet owner. It's just filled with anxiety, right? And so much uncertainty. So in this explainer, we're going to try and get some clarity on this together. All right, let's just rip the Band-Aid off and start with a really hard truth. Dental procedures kill cats. I know, that is a stark statement. It's probably your biggest fear, and I want you to know your concern is totally valid. Look, it's not the most common outcome, but it happens. It happens often enough that we absolutely need a better way to think about this decision. And that's exactly what we're going to do. We've got a clear roadmap for this talk. First, we'll dig into the dilemma itself. Then, we'll get real about the risks. After that, I'm going to walk you through a step-by-step framework to help you decide. We'll look at the different paths you can take, and we'll wrap up with how you can advocate for your cat and feel confident about it. All right, so let's get into it. Here's the core conflict, the real dilemma. On one hand, we know dental disease is painful, it's bad, and it needs to be addressed. But on the other hand, for a lot of our cats, especially the older ones or those with chronic health problems, the procedure to fix it comes with its own set of pretty serious risks. So many of you have probably seen this, or at least heard about it. It's a heartbreaking pattern. A cat, they seem to be doing okay, they go in for a dental, and they come out so much weaker and just decline fast. Now, a vet might say, oh, it was an underlying condition, but honestly, the timing is just too common to ignore. And that's the reality. That's what makes this decision so agonizing. Okay, so if we're going to make a good choice here, we really need to understand why this procedure is so tough on them. It's really easy to just point the finger at anesthesia, but it's more than that. It's actually a whole bunch of things, all happening at once, that can just completely overwhelm a fragile little body. So who are we talking about here? Who is most at risk? Well, if your cat fits into any of these boxes, and let's be real, a lot of senior cats do, especially with something like even mild kidney disease, then you have to know their ability to bounce back from something big like this is already not what it used to be. It's compromised. And this, right here, is such a key point. The risk is not just the anesthesia. Think of it more like a cascade, a waterfall of stressors. You've got the vet visit itself, which is stressful. Then there's fasting. The IV fluids can be really tough on weak kidneys. Then you've got post-op pain and inflammation, antibiotics messing with their gut. For a young, healthy cat, they can handle it. But for a fragile cat, that cascade can literally be the final straw. It's what can push their system over the edge. Okay, so now we get the risks. But how in the world do you make a decision without being totally paralyzed by fear? Well, this is where having a structured framework is an absolute game changer. It helps take some of the emotion out of it and just gives you a clear, logical path to walk down. So we're going to walk through these 4 steps together. Step 1, assess your cat's baseline health. Step 2, assess how bad the dental problem really is. Step 3, ask one really critical question. And finally, step 4, choose your path of care. So let's dive right into step 1, assessing their health. Step 1 is what I call the traffic light system. It's pretty simple. Is your cat in the green light zone? Under 8 or 9, good health, pretty stable. A dental is generally a reasonable, safe bet. Or are they in the yellow light zone? Maybe 9 to 13, some mild kidney issues, maybe losing a little weight. Here, you really only want to proceed if that mouth pain is truly hurting their quality of life. And then there's the red light zone. This is for cats over 13, frail, with significant health problems. For these guys, the risk is just very high. All right, step 2 is looking at the dental problem itself. On one side, you've got your mild to moderate issues. Some tartar, a little gingivitis, but no obvious pain. The cat's eating just fine. For an at-risk cat, a yellow or red light cat, the decision here is probably to delay or even skip it. But then you look at the other side, the severe stuff, stomatitis, abscesses, pain so bad they're refusing to eat, maybe even facial swelling. This is a quality of life crisis, and this is when the procedure might be worth the risk. Okay, now we're at step 3, and this is maybe the most important question in this whole process. This is the one you have to ask yourself, and you have to ask your vet. Just for a second, forget about the mouth. Look at the whole cat and ask, if we fix the mouth perfectly, will the cat's body realistically recover? Does their body, their kidneys, their heart, their whole system have what it takes to handle the stress and bounce back? Your gut answer here, whether it's a yes, a maybe, or a no, that's what's going to guide every single thing that comes next. So based on where you landed in those first 3 steps, you're going to find yourself heading down one of these 3 paths. And I need to be super clear about this. Every single one of these options is a valid medical choice. There is no wrong answer. There's only the answer that is right for your cat in their situation. So for our green light cat, the choice is usually pretty straightforward. We go with option 1, a full dental. This is the whole shebang: full mouth x-rays, extracting all the problem teeth, supportive IV fluids, and really good pain management. For a healthy cat, the benefits of getting that mouth clean and pain-free just far outweigh the pretty low risks. Now, for that yellow light cat, the cat where the answer to our big question was maybe, well, that's where option 2 comes in, the conservative dental. The whole goal here is to reduce risk. The vet goes in, takes out only the teeth that are clearly causing pain, and then gets out of there as fast as possible. The less time under anesthesia, the less stress on their body. It's all about minimizing the impact. And then we have option 3 for a red light cat, the one where the honest answer to our question was probably no. For this cat, palliative care is often the kindest, most compassionate choice. The goal completely shifts here. It's not about a cure, it's about comfort. That means top-notch pain management with things like gabapentin, using antibiotics only when there's an active infection, and just doing everything you can, like offering soft, warm food, to keep them happy and eating without putting them through the trauma of a major surgery. And please, please hear this. This is so important. Choosing palliative care is not giving up. It is an active, loving medical decision. You are choosing to prioritize comfort and quality of life over everything else. It's about being realistic and matching the treatment to what your cat's body can actually handle. Okay, we're at our final section, and this is all about empowering you. Because once you've used this framework to make your decision, you need to feel confident. Confident in talking about it and confident in finding peace with whatever happens next. This right here is such a powerful way to reframe things, because guilt is it's a crushing weight for pet owners. So instead of asking yourself, did the dental cause my cat to die? A question you can never, ever truly answer, try asking this instead. Did this intervention reduce suffering, even if it might have shortened their life? Think about it. If you chose a dental and got 3 more good, pain-free months, the answer is yes. If you chose palliative care and avoided the trauma of surgery, the answer is also yes. Both are acts of comfort. So what do you actually say to your vet? Look, you have to remember vets are trained to fix things. Their default setting is often going to be, let's do a full dental. But you are the expert on your cat. You see them day in and day out. You know their resilience. So the goal here isn't to just take a recommendation, it's to have a real collaborative discussion. And here are some really powerful questions you can take with you. Don't be afraid to ask them directly. Ask, given her age and health, what's your honest assessment of the risk? Or, can we try a more conservative approach, just taking out the worst teeth? Ask, if we decide against the dental, what are our options for just managing the pain? And this is a big one. What's your personal experience with cats in this condition surviving this procedure? These questions open up a whole new level of conversation. And in the end, that's really what this all comes down to. You've got a framework now. You have the right questions to ask. You see the options clearly. But the most important thing you have is you. You know your cat better than anyone on this planet. Trust that knowledge, trust your gut. You absolutely can make the right decision for them. I really hope this has helped.